Well, thank you. I imagine you're getting a little weary about now, and it might well seem as if we're changing the subject, but we're actually not. Let me begin by thanking the Clinton Foundation and the Health Matters Initiative team for including mental health in this year's discussion. I think that's critical. I know that President Clinton thinks so, and I want to take a few minutes and to try to frame that issue in the context of our overall discussion. As Surgeon General in 1999, I had the opportunity to release the first ever Surgeon General's report on mental health. And then I was asked by the Director General of the WHO, who at the time was Gro Brundtland, if I would come to Geneva and present our report before that body in May of 2000. So it hasn't been that long that we've really started to discuss mental health at this level. And I have to say that our major recommendation in our report was for parity of access to mental health services. And that was 1999. It was not until 2008 that legislation was passed. It was actually signed by President Bush in October of 2008 for parity of access to mental health services, and then President Obama issued an executive order that resulted in it, among other things, being a part of the Affordable Care Act. Let me begin by defining mental health. And I want to do that because we almost immediately get to mental illness. But I think mental health is really critical to think about. In our report, after a lot of debate, we define mental health as the successful performance of mental functions, such that one is able to be productive in his or her work, to develop and maintain positive relationships with other people, beginning with families, to adapt to changes in one's life and environment, and to deal with adversity. Just think about that. Being productive, developing positive relationships with others, adapting to change, like adolescence, for example, but adapting to change and dealing with adversity. We saw 30% rate of depression in New Orleans after Hurricane Katrina. So mental health is that. It's being able to deal with these life challenges and circumstances and to be productive. Well, it should follow then that mental disorders, mental illness, represents alterations in those mental functions such that one is unable to carry them out because of mood disorders or thinking disorders or behavioral disorders. So mental disorders follow immediately from that definition of mental health. But I want you to think about that because I don't want you to take your mental health for granted, because that's what we do. We take our mental health for granted, and therefore we're not sympathetic when people have mental illnesses, because we haven't thought about our own mental health, and we haven't thought about the fact that we could lose it. And so we don't want to take our mental health for granted. There were 5 key messages in the Surgeon General's report that came out in 1999. And the first message is that mental health is fundamental to overall health and well-being. Mental health is fundamental. And mental disorders are common. Just as things go wrong with the heart, the lungs, the kidneys, and the liver, things go wrong with the brain. They always have and they always will. The only question is, how will we respond as individuals, as families, as a society? Mental disorders are common. We estimated that 20 to 25% of Americans will experience a mental disorder in any given year. Almost 50 million people, and somewhere around 13 to 14 million children experiencing some kind of mental disorder each year. Mental disorders are disabling. They are as disabling as cardiovascular disease or cancer. In fact, studies show right up there with cardiovascular disease and cancer, or between the two in terms of disability. Mental disorders are disabling. But there was some good news in our report. And the best news, of course, was that mental disorders are treatable. That 85 to 90% of the time, we should be able to treat people with mental disorders and to return them to productive lives and positive relationships. Mrs. Carter, who held the first ever White House conference on mental health, likes to say that recovery is possible. There's hope because recovery is possible, and indeed it is. We have that ability. The bad news in our report was that more than half of the people who experience a mental disorder will not get the treatment they need, and only about 1/3 of children. There are a lot of reasons for that in terms of our system, but there's also the issue of stigma. The fact that even today we still have a lot of stigma surrounding mental disorders. And we keep trying to push back the stigma so that people will realize that mental disorders represent a brain disease. And as I said before, just as things go wrong with the other organs, they go wrong with the brain. And I hope I don't have to tell you that the brain is the most important organ in the body. It is the most important. And if it's not functioning right, nothing else functions right. We're involved now with the NFL and dealing with the issue of chronic traumatic encephalopathy among former football players and trying to prevent it among people coming up. It's not just football. I mean, think about boxing, soccer, hockey. But the brain is too important an organ to be subject to the banging of heads. So we have declared that the banging of heads can no longer be considered a sport. The brain is too important. And that's the message that we're trying to send at every level, because kids start banging heads in elementary school. They do what they saw the guys on TV do. So those were our major messages. And I think that we made some progress, and I don't have time to talk about those, but we have the integration of mental health and primary care. We have now integrated mental health and primary care in 5 community health centers. We've developed a strategy for treating mental health emergencies in the emergency room so as to give dignity to the individual and the family, but also to try to transmit them to continuity of care. And we've demonstrated over 2 years that, number one, we could reduce waiting time by as much as 80% and reduce the cost by 60%. So we can do a lot of things to improve mental health and mental health care. I want to say a word about the relationship between mental health and substance abuse and addiction. And you have an outstanding panel that's following me who's going to talk about these issues and how they experience them in different capacities. But let me say that addictions are, in fact, brain diseases. And dealing with addiction requires one to seriously encounter addictions as a brain problem. Christopher Lawford, in his recent book, Recover to Live, talks about what people with addictions go through and the importance of hope in recovering. You're familiar with the 12-step program. According to Pamela Hyatt, the director of the SAMHSA, the Substance Abuse and Mental Health Services Administration, about half of people, according to her, who are addicted have diagnosable mental disorders. And conversely, of course, what we see is a relationship between the severity of the mental illness and the risk of addiction. So there is clearly a relationship. And it's something that we have to take seriously as it relates to children especially. Alcohol, of course, is the leading addiction affecting certainly millions of people in this country, costing millions of dollars and lives, but also becoming addicted to illicit drugs of various kinds, and now, of course, more and more prescription drugs. But there are other addictions, as you know. There's gambling, there's sex, there's hoarding. They can all become addictions, subject to the same obsessive compulsive behavior, which you will hear more about. So addictions are serious. They cost millions of dollars and millions of lives every year. But prevention is possible and recovery is possible. Let me close by trying to reconnect our discussion throughout the day with this issue of mental disorders. When I left government, after releasing this report on overweight and obesity in December of 2001, we started a program called Action for Healthy Kids, working with schools. And in this program, we were trying to get the schools to go back to physical education K through 12, and just really taking more seriously the way children eat at school. And the schools came back at us. They said, you know, we have all these problems, you know, we're trying to keep programs going, having to cut out music and everything else, and now you're going to dump this problem, trying to deal with no schools left behind, and so you want to dump this problem on us. And it went on like that until 2005, in which, in reviewing the literature, it became clear that children who were physically active and consumed a healthy breakfast learned better. They were more disciplined in the classroom. They performed better on standardized exams in reading and math. So we called that the learning connection. And in fact, 3 months ago in Washington, we had an updated conference on the learning connection. But there is this connection between healthy living and mental health. There's this connection that we should not forget about in terms of healthy lifestyles. And if we want our children to perform optimally, they need to be physically active on a regular basis. They need to engage in good nutrition. And you know, that was a connection that we saw. It was an association. But as scientists, we want to go beyond that. We want mechanisms. And now, of course, we have studies showing changes in the brain that takes place when children are physically active and engage in good nutrition. Whether it's the frontal lobe or the hippocampus, there are changes that you can now track that go along with healthy lifestyles. And so it takes us to another level, but still, knowing all of that, we have not been able to get to the point where we as a society are committed to investing in our children being able to engage in physical education K through 12 and to have good nutrition. Now, there's a relationship here I think that's really important, and it is that schools tend to be the great equalizers. Now, I grew up in Alabama during the worst period of discrimination and segregation, and our parents used to tell us that if you just stay in school and get an education, you know, you can go whenever you want to go, do what you want to do. Even though they had less than an elementary school education, they somehow knew that there was this connection. And so the schools were viewed as the great equalizers. And I think when it comes to this problem, and so many children growing up in homes and communities where they may not have access to healthy lifestyles, healthy food, hopefully that's changing, may not have access to regular physical activity. Hopefully at school, they will have that. And again, I don't think we can dump the problem on the schools, but I think the schools need to be major players. And especially now that we know that there is, in fact, this connection between healthy lifestyles and mental health, mental acuity, performance. We even know, for example, that in treating depression, that physical activity should be a major part of that treatment. Some studies show that physical activity is equal to medications, but ideally we now know that it should be a combination of physical activity, and medication in treating depression to be optimally effective. So those are the things we know. The brain is a part of the body. It is, in my opinion, the most important part. And so I think when we talk about healthy lifestyles, one of the major benefits will be on the brain, and there will indeed be a connection not only between learning, but between living healthy lives and mental acuity, and reducing mental disorders and promoting mental health through healthy lifestyles. Thank you.
Ladies and gentlemen, please welcome the chairman of Brian's Wish, Gary Mendell.
Good afternoon, everyone. It is truly my privilege to be here today. I would like to extend my appreciation to President Bill Clinton, Chelsea Clinton, and their Health Matters initiative for bringing to the forefront these two important issues, mental health and addiction, which, as Dr. Satcher said, are so clearly related. There is so much I want you to know today about addiction. I could speak about the facts all day, but today I'm here as a father, and I'll speak to you as a father. Because if you leave here today knowing just one thing, I'd like you to know about my son, Brian. Brian was, from the beginning, a very loving child and always cared about others. But he also struggled. He struggled with anxiety, and he struggled with ADD. He was the last to be picked for soccer, but he was the first to crawl under a fence at Yankee Stadium to give a homeless person a quarter, which he did when he was 8 years old. That was Brian. As a teenager, as many of our kids do, he tried marijuana. As his use escalated, his mother and I tried absolutely everything. Wilderness programs, therapeutic boarding schools, the best rehabs in the country. And Brian tried his hardest too. He even made it to college. But unfortunately, addiction is a harsh and unrelenting disease. Harder drugs followed, more relapses, more rehabs. From one program, Brian wrote me, "Dear Dad, I want you to know I am trying my absolute hardest to be a good son." To know Brian's character and the cruelty of addiction, I have to tell you what happened on October 20th, 2011, when Brian was 13 months clean. He spent the morning researching suicide notes. The first he read was Kurt Cobain's. Kurt was angry and bitter, but Brian was not. His note was about his sadness and tired resignation. And even in his last minutes, his thoughts were about others. "I don't want to hurt anyone anymore," he wrote. "Do anything illegal or get high. I thought sobriety was worth a shot, hoping to get back to normal life. But it hasn't worked. I love you all more than I can write." Then my Brian, the same Brian that at 9 months old, I remember playing peekaboo with him around our coffee table in the family room, and he would crawl around the table and look up at me with that smile of his. Then my Brian, he hung himself. He was 25 years old. I wish I could tell you that the anguish dulls with time, but it doesn't. It intensifies with me knowing that my son died of a disease that is preventable and we don't prevent, that is treatable but we don't treat, that is undeniable and we continually deny. A disease that in the time of this panel in 60 minutes will claim 15 more Brians in 60 minutes. A disease that today, while we're at this conference, 350 more Brians will die. And 350 more family members, 350 more families will be torn apart forever, as has my family. In the aftermath of Brian's death, I set out to learn what could be done to spare other families from this suffering. It's been a journey in darkness. Addiction works that way. It is shaded by stigma, family struggle, and isolation. For other diseases, there are research budgets, breakthroughs, and medications. For addiction, there is some research, but is not put into practice where it could have saved Brian's life and the life of so many others like him. For other diseases, there are national nonprofits like the American Cancer Society that provide a place for families to turn to for information, for support, and hope. For addiction, there is no such entity. That is Brian's story. That's my story. And if it were our story alone, it might end there. But it must not end there, because it is the story of 20 million Americans suffering every day with the disease of addiction, and 80 million family members who love them dearly. So for their sake, and as a pledge to the Clinton Health Matters Initiative, and in Brian's memory, I have made a promise. Enough. Enough. No more research ignored. No more Americans suffering alone, feeling ashamed because they have a disease. No more lives wasted. That is the promise of Brian's wish. Our new organization will launch later this year with a new name that reflects our national mission. We'll make a permanent and large-scale impact on this disease. The goal is simple: to cut in half the number of Americans who suffer from this disease, the number of Americans who die from this disease, and the cost to our society of this disease. The solutions are clear: prevention, treatment, recovery. We will provide resources to families. We will ensure parents know what puts their children at risk. We will move research off of scientific shelves into our communities where they belong. We will pressure policymakers for legislative changes that make common sense. And once and for all, we will eliminate the stigma of addiction. All this, I promise, as a parent who knows the anguish of bearing his child. These are promises whose ultimate success depends on all of us. Addiction requires a national commitment. Addiction requires a national voice. It claimed my son, Brian. It is not too late to save another parent's child. Thank you. And now I would like to introduce John Schwarzlose and our panel to come up on the stage. Thank you.
Gary, that was simply incredible, and what a way to start this discussion. Thank you very much. Congratulations to Health Matters and the Clinton Foundation for making sure that addiction and mental health were part of this conference. 90 to 95% of conferences that are on health and healthcare do not include anything on mental health and addiction. And we just cannot say enough about President Clinton and the staff for making sure this topic was included. And indeed it should be. Look at the tragedies we have dealt with as a country in Connecticut and Colorado over the last year. Everyone talks about guns. Very few people talk about mental health. President Clinton today talked about some headlines in the last year that he paid particular attention to. Well, one that I paid attention to, I hope some of you did, was a headline that appeared in most newspapers saying that we now have more deaths each year from prescription drug overdose than we do from automobile accidents. And it was a shocking headline, and I hope it just doesn't sit there as a headline with little action. But we've put a panel together that are going to address this, and we make sure that we'll leave time for your questions. There is a polling question to start with. Approximately how many people in the United States die each year from drug and or alcohol addiction? So again, as you've done before, please text your answers in, and we'll revisit that and see what your guesses are on that question. We've asked each member of the panel to take a few minutes and share with you, and then we will all take part in answering questions that people have. So first, let me introduce the newly elected senator from Connecticut, Christopher Murphy.
Well, thank you. Thank you very much, and thank you for having me and for having this panel today. For the last 30 days, I've been eating and sleeping and breathing Newtown, Connecticut. I represent Connecticut now in the United States Senate, but prior to my swearing in last week, I was the congressman from Newtown and from Sandy Hook. And so that day, I was on the scene a couple hours after the incident took place, and just to witness that just hulking, incomprehensible grief is something that, a lot of days I wish I hadn't seen, but when we were there and those first reports of the shooter were coming in, they were conflicting as to who it was, how many there were. We knew who it was, because though we were now the subjects of the TV stories, we had watched this on TV before. We had seen Littleton, and we had seen Aurora and Tucson and Blacksburg. We knew that it was most likely a very deeply emotionally troubled, mentally ill young man, probably in his early 20s, probably white. And we don't know everything about Adam Lanza that we want to know, but we certainly know that he fits that description. And the horrifying fact is that beyond all of this increasing anecdotal evidence of people with mental illness who can't find treatment and then go and do something very destructive, are some equally troubling statistics. Today, there are over 8 million children and young adults that are living with a diagnosed serious mental illness. That is triple the number of young adults and adolescents who were diagnosed when President Clinton took office. The number has exploded, and we're probably not going to have all the time to examine exactly why that happened, but the concurrent problem is this. Over the last 4 years, as the recession hit state budgets, which primarily bear the burden of taking care of these kids, funding for mental health has dropped by about $4.3 billion all across the country. Just during those 3 years, demand on those services went up by 10%. And so that bad news is the foundation for what could be good news to come. the hope is that what comes out of Newtown is absolutely a discussion about whether or not we want these kind of guns on the street, but it gives us an opportunity to really confront some tough questions about how we treat mental illness and how we fund it. And I'll just flag 2 issue areas of concern for me. I frankly think the NRA has gotten everything wrong in their approach to this tragedy in the last 30 days, but maybe the most troublesome of their proposals is a suggestion that we should have a national database of everyone with a mental illness, as if there is some direct correlation between people who have a mental illness and a predilection towards violence. We have made so much progress in the last 15 years in overcoming that stigma associated with mental illness, so that, like my family that has a long, proud, open history of mental illness, that we can treat it just like a physical illness. And we can wipe that all away if we get the response to Newtown wrong in this way. If we go with those that say the answer here is to just keep a database of everybody with a mental illness, or even with a serious mental illness, first we feed this belief that everyone with a mental illness somehow is prone to violence. Violence is layered on top of mental illness. It is not inherent in mental illness. And second, we're just going to make it even harder, especially for parents with kids who maybe have a son or daughter that are on the verge of serious mental illness, from getting help, because what if help means that your kid is going to be put on a mass murderer watch list that they can't ever get off of? And so we got to be very careful about how we approach this question. Right now, today, you are not allowed to get a gun in this country if you have a serious mental illness that you have been adjudicated on, such that you could be prone to violence. I think we can make that a little tougher. I think we can talk around the edges of it, but I think it'd be really dangerous to further stigmatize mental illness. The second question is this: are we going to step up to the plate on funding? We know there's crisis in terms of the budget, and the question is, are we going to balance the budget on the backs of state and federal mental health budgets? One of the things in my short time in Washington that I've been sort of stunned about is that we often go looking for answers to big problems without actually sort of figuring out what the question is first. And what I mean by that in the context of mental health is this. We right now have these 2 twin neurological funding crises in this country. We have an aging population with Alzheimer's and Parkinson's and dementia that is gobbling up more and more of our budget. And we have, as I mentioned, a tripling of the number of children and young adults who need access to the mental health system. And whether we want to admit it or not, these 2 crises are in competition with each other. And whether we want to admit it or not, one is winning and one is losing. I know we need to do a lot more in terms of access to seniors who have serious neurological illnesses, but the fact is that if you're an Alzheimer's patient and you're on Medicare and Medicaid, you are basically going to have a pretty good shot to get what you need. Correspondent to that is that deeply troubled, mentally ill young man, isolated, living in his parents' basement, contemplating evil, is most likely not going to get what he needs. We've already made that choice in the way that we've structured our funding laws today. And we need to be honest with ourselves that if we don't start thinking about that choice and whether or not we want to continue to make it, then we're not going to be able to find the money someplace else. And so these are the conversations that I hope come out of this. Let's be honest about where money is today in our mental health system and where it is not. And let's make decisions, yes, about whether we want to put more money into the whole system or whether we want to transfer money. And then let's make sure that we don't do anything in the wake of Newtown that makes it even harder for that parent who knows that they've got a son or daughter that needs a little bit of help from going out and getting it. I think there are some very important things that can come from this horrifying last 30 days if we get it right.
Thank you, Senator. Next, we have Mr. Harris R. Next on our panel, Mr. Harris R. Schwartzberg, the CEO of the Schwartzberg Companies.
Thank you. I'm here because I'm very passionate about mental health, because I think of all the things we've talked about today, it's one of the few things that we can all immediately impact. I can speak about it on many levels. My family was touched directly by mental illness when my brother passed away about 5 years ago at the age of 47 after battling bipolar disease his whole life. I watched my family fight with it. I watched my sister, my parents, and I see how it can tear apart a family. and we're just one of many millions. I see it as an employer with 15,000 employees, and knowing statistically that of my 15,000 employees, roughly 3,500 to 4,000 are dealing with some sort of depressive disorder, and how that's impacting me as a business. I see that on top of that 3,500 to 4,000 employees, another 4,000 are dealing with family members that have similar issues. So when you look at mental health from an economic standpoint, it's very simple to see the massive impact it has on our economy. We don't just see it in the way that the government measures it with the fact that $50 billion of absenteeism, but we also measure it with presenteeism, when we've all been there before, when you have something else on your mind and you're really not working. I'm here also as a parent of 3 girls that I know have to deal with many issues every day, but the real reason that I was asked to speak and I've become so passionate is the issue is very scary. The statistics, I don't have to repeat them, everybody's gone through them already today. The number one market right now for antidepressants is preschoolers. That's kind of a shocking number. You can't even imagine talking to a 2 or 3-year-old about these issues, but that's one of the biggest numbers out there right now. So the fear that we have in my house and my family and everybody here, we've taken a little bit of action ourselves as well. We've luckily met the University of Michigan Depression Center, which has a comprehensive depression program, and we funded a stem cell research program there, sort of for the long term, to see what could happen for our grandkids and my grandkids and all of our grandkids. And then we went a little bit further and realized that in our own community, there's nothing really going on to help these kids that are under so much stress, anxiety. So we teamed up with the University of Michigan Depression Center and a local high school, Byram Hills High School in Armonk, and created a program called the EVEN program, which is to fight and teach teachers and children how to handle depression and anxiety, because what we're starting to see from all the studies, et cetera, that we're looking at is you can make a difference. What makes a difference is really just reaching out and speaking to people. As Gary very eloquently said before, the issue here is stigma. And the stigma goes away when you're okay talking to people, when you reach over to your neighbor and say, hey, what's going on? So we've gotten very involved in what we hope is going to be the first of a nationwide program with the principal, Chris Borsari, who is a unique individual who has really taken this program and run with it, and we've seen the impact that it's had on the kids. But we're really here, and I'm really here to discuss that we can help this stigma. We can talk about it. We all live in similar communities. We all know that, God forbid, somebody has breast cancer or somebody has a heart attack. You might call them up or call the husband or the wife and say, hey, do your kids need a lift somewhere? Do you want me to drop off at dinner? How can I help you? But you've never done that when you've heard that somebody just institutionalized their 16-year-old. And there's a problem with that, because the insidiousness of mental health is that it's not physical. You can't see it. It's the guy sitting next to you at the train. It's the high school quarterback. It would be better if it was a third arm, so you could notice it and say, hey, now I see what it is. But you can't, because it's out there and it's not identifiable. And we have to realize that these people, regardless of the severity, it's a sickness and it's an illness, and we can't just turn away from it. We have to help. And that's what we're hoping the programs that we're putting together and the work of the Michigan Depression Center will do. And being out here talking very openly is a great first step. As I was telling somebody behind the stage, it's great to talk about all these great things that we could do, but in the full day that I've been here listening to everybody, the best thing that I saw from a mental health perspective is when President Clinton was proud of his daughter Chelsea and gave her a kiss after her presentation. And you know what? It sounds silly, but that's what we all have to do, because the kids have to see it.
Next, I'd like to introduce Carolyn Jackson, who is the CEO of St. Christopher's Hospital for Children in Philadelphia. Carolyn?
Thank you. St. Christopher's Hospital for Children is part of Tenet Healthcare, and we are located in North Philadelphia in the third poorest and second most food insecure congressional district in the nation. Needless to say, our children grow up with significant challenges and significant health disparities. When I first came to St. Chris in 2010 as the CEO, I knew that we needed to consolidate our general pediatrics practices on campus, and I knew that we needed to expand them for better access. We have over 25,000 of our local kids who receive their primary care on our campus. The thing that I didn't know when I started was that we needed to change the care model. And unfortunately, it took a bullet-riddled car outside of our emergency department for me to realize that. Almost exactly a year ago, a group of teens in our area were fighting after school, and a carload of boys drove over to the home of 3 brothers to settle the score. When they arrived, the 30-year-old stepfather of the 3 brothers came outside and fired at point-blank range into the car, killing the 3 of the teens and wounding the driver. The driver immediately came to St. Chris, the place that he knew, the place that he trusted, the place where he and his friends had received care since infancy. That was when I realized that it wasn't enough just to have better access. We needed to find a way to help these kids break out of the cycles that their circumstances have put them in. So we created the Center for the Urban Child. It will be going into a 30,000 square foot office building on our campus that Tenet Healthcare has graciously approved for us to build this year. The Center for the Urban Child strives to provide high quality, efficient, cost-effective care for the kids in our local community while providing the wraparound services that will address the social determinants of their health. Everything from food insecurity to domestic violence to behavioral health. From a behavioral health standpoint, prevention is the thing that we really want to focus on the most. Most pediatricians don't treat mental illness. They're not comfortable with it, and they don't take the time to diagnose it. We will be training our pediatricians as well as the pediatric residents who go through our general peds practice to look for the signs and symptoms of behavioral health problems in both the children they care for as well as their parents. We also will arm them with the tools to care for the less complex behavioral health issues, things such as mild depression and ADHD. We will have psychologists on site who will be able to come and help the children immediately if something is determined as a potential that may be a more complex issue. Our practice will be set up in a way so that we'll have 4 or 5 exam rooms to every, or 1 consult room to every 4 or 5 exam rooms. So we'll be able to pull the children out to receive care from a specialist or from some type of a social agency there on site. A big focus in the area of pediatrics recently has been adverse childhood experiences. Much like what we've seen in Aurora, Colorado and Newtown, Connecticut, there are events that happen every day that are small events that we don't think of, but have just as big of a long-term impact on kids. These toxic stressors, whether they be drugs in the home, whether it be violence on the streets, have long-term impacts on the behavioral and physical health of kids in communities like St. Chris. So we want to make sure that we're also building the resilience into these children so that they can overcome their circumstances. I'm very pleased to say that joining us in a couple of weeks will be Dr. David Schoenfeld as our pediatrician-in-chief. Dr. Schoenfeld is the director of the National Center for School Crisis and Bereavement, and he has spent time recently in Connecticut and in Colorado helping those communities and helping the adults in those communities teach the children how to overcome and how to have resilience and get past the terrible tragedies that happened. And we believe that Dr. Schoenfeld's expertise as a developmental pediatrician, as well as with the National Center, will help instill that same resilience in the kids in our community. So our goal with the Center for the Urban Child is to give these kids the tools they need to rise above their circumstances and to become successful contributing members to our society. Thank you.
Good job. I'd now like to introduce Mr. Vin Gupta, Managing General Partner of the Everest Group.
Thank you. In my family, I have 2 extreme situations. My dad is 95. He's a doctor and is in good health, still working 6 days a week. And Sunday is the day he does not work, and he's very upset because he's not working. And he runs a charitable clinic in near New Delhi, and they get like 600 patients a day, and they dispense free medicine and free consultation. On the other hand, I lost my son, who was 28 years old, exactly about 2 months after you lost your son, Brian, on December 19, 2011. And I couldn't believe what happened. Apparently, in the morning, he just never woke up. I found out that, we went to Washington, D.C. He was doing his JD and MBA program. He had one more semester to go, and he would have received his JD and MBA. And he just died all of a sudden. So I talked to the doctor who was in the coroner's office, and he was an Indian guy, and he said, listen, I can tell you right now what happened. He said, it's a mixture of oxycodone and alcohol. He said, you will not believe how many young people are dying mixing prescription drugs with alcohol. And then I said, wouldn't they get sick? Something would happen, like when I used to get drunk, at least we would get sick. He says, no. He said, you take oxycodone or any of these Oxycontin and you mix it with alcohol, and your heart just, it just quits functioning. Your brain does not give the signal, and your heart just quits functioning, and you just die, So I called President Clinton, and I saw him, and he knew all about it. He had done a lot of studies, and his own neighbor who lost his son in the same way, within 10 days, I lost my son. And he said, we have to get the word out as to how these things happen, So he called Sanjay Gupta at CNN, and Sanjay Gupta and President Clinton did a 1-hour program, which was just aired a few months ago, and I think it's still running. They're rebroadcasting it. And they talk about that last year about 15,000 people died from the misuse of prescription drugs. And these are young lives, those lives which can be saved, They don't have to die that way, And the program was on TV. It was very well received. I got hundreds of emails from people, hundreds of families who had lost their children the same way, And then every day we read something in paper, in Wall Street Journal, New York Times. They are talking about the prescription painkillers, how they are being abused. And a lot of times these people don't even know that if you misuse, or if you take the prescription drug, mix it with the alcohol, it's lethal, And so finally I told President Clinton that what we want to do is support the foundation in helping, how to prevent future deaths. But these lives are they can easily be saved, So anyway, he was gracious enough to help us in this mission, and that's why I'm here. Thank you very much.
Thank you. Next, we have Commissioner Ray Kelly of the New York Police Department. Commissioner Kelly.
Thank you. I want to thank the Clinton Foundation for inviting me. And of course, I want to thank President Clinton for his tireless efforts to improve the lives of millions of people throughout the world. I've been asked to speak about the challenges of prescription drug abuse, and I want to give some examples of what we face in New York City. Last year, 2 men walked into a pharmacy in East Harlem about 11 o'clock in the morning. They were armed with guns. One threatened the cashier, and they had very specific directions. They wanted all the Oxycontin and Percocet in the 30 milligram size. One of the clerks pushed the panic button. 3 police officers showed up quickly, and one of the men surrendered. The second started to shoot at the police officers. He ran out the door. There was a retired police officer across the street filling his car with gas. He shot and killed this individual. Now, this brought to an end a situation that could have been extremely tragic. This individual was wanted for 4 very similar robberies and several shootings. In Long Island, just before that, an off-duty ATF agent went into a pharmacy to get drugs, cancer drugs, for his father. He interrupted a holdup. He was shot and killed trying to take action. The perpetrator was also shot and killed by responding officers. He had in his possession cash and Oxycontin. And then just before that, on Long Island, an individual went into a pharmacy. He had no criminal record. He proceeded to shoot and kill the 2 workers and 2 customers in the store. He too was looking for prescription drugs for himself and his wife. Now, we in the police department have seen the destructive power of addiction firsthand. We had a police officer who was injured in the line of duty. He was given painkillers. He started to abuse them. He then started to rob pharmacies on his own. And interestingly, with him and with some of these other robberies, we go into the store and only look for Oxycontin. Did not touch the cash drawer. So that is clearly an indication of the tremendous power of this addiction. Of course, we are concerned about the abuse of prescription drugs being a gateway to this type of conventional crime, particularly for young people. The drugs get expensive. They switch to heroin, to cocaine, and to violence to support this sort of habit. And obviously, with the proliferation of guns on the street, we certainly don't want that to be compounded. Now, I must say that as far as health is concerned, the overarching issue in urban policing in America today is the fact that there are so many concealed weapons, handguns on the streets. In New York City, about 60%, 60 to 65% historically of our murders for the last 20 years have been with handguns. Now, through the last year, we've been able to drive murders down to a 50-year low. And we've done that, we believe, through proactive policing, through saturation policing in areas where there's increase in crimes of violence. We've taken thousands of weapons off the street, and we believe that we've saved countless lives in doing that. But certainly the abuse of prescription drugs makes our job that much harder, and in part because of the source of these drugs, the nature of the source. Virtually all of them, unlike heroin, cocaine, other illicit drugs, begin with a valid prescription. So healthcare professionals, doctors and pharmacists in particular, are involved either wittingly or unwittingly in the facilitation of the abuse of prescription drugs, and there's a lot of money to be made in this business. Last year, with the Drug Enforcement Agency, we raided an outdoor market in Washington Heights in Manhattan, and where they were selling the types of pills hand to hand, and confiscated 9,000 pills. Now, we have, and in the last 18 months, we've conducted and have still ongoing at least 24 major drug diversion, prescription drug diversion cases. So we have put together a strategy that we believe can make a difference, and this strategy really forms the foundation of our pledge to the Clinton Health Matters initiative. And the first is we have formed a drug diversion task force with the Drug Administration Association. This is a significant force multiplier for us. It also gives us access to their nationwide distribution database, and this has been extremely helpful in aiding us to attack this problem. Secondly, we've created an awareness program focused primarily on students in high school and college. We've teamed with the Department of Education. We put together a curriculum that was finished in November of last year. We've begun teaching it in schools. At least 1,000 students have already been taught And of course, our goal is to teach many, many more. This fall, we will begin giving this sort of orientation at freshman orientation. Actually, when freshmen come into colleges in New York City, we have 71 colleges, and we think this can be effective. These are police officers that will be giving this training. Third, we want to reduce the number of robberies and burglaries that take place in this area. And we are in the process of constructing a database of 6,000 pharmacies, not only in New York, but in Connecticut and New Jersey as well. We call it SafeCap. And with this database, we will go out and give them, we believe, very useful crime prevention information, better lighting when the stores are closed, an alarm system, that sort of approach. We're also doing a bait program, if you will, with the producer of OxyContin. And that is where we will have and distribute OxyContin bottles that actually have GPS inside them, so that we will be able to track the route of people who steal or rob this drug to stash houses and perhaps other locations. We think it can be a major help in conducting investigation and also deterring this type of theft. And fourth, we have engaged in a major training evolution for our own people, police officers and the over 5,000 school safety agents that work in the in New York City Police Department. We want to make them familiar with being able to identify these drugs and also what to do when they respond to the scene. And if anyone, they can observe anyone who is obviously being affected by the drug. Now, just last Thursday, Mayor Bloomberg put out a directive to the emergency rooms in New York City that they are not to give any prescriptions for long-term or long-use opiates, and also that a prescription is only good for 3 days, and that the emergency rooms will not fill any that have been reported stolen or lost. Now, we think these are common sense initiatives that will make a difference. Nothing you do is without a cost. This will cost us about $4 million, but of course, if it saves lives, it'll be well worth it. So that is the basis of our pledge, and we look forward to working in collaboration with the Clinton Health Matters Initiative. Thank you.
Thank you, Commissioner Kelly, and again, Gary Mendell.
Thank you. This is on? Yes. Well, I already spoke, so there's not much more I have to add. I think after hearing the panelists, what I would add is I think every panelist spoke with some wonderful ideas and programs they're each doing individually. Where I think the opportunity is what I've seen as I've looked at this over the last year, is what I've seen in other diseases. You know, in heart, the American Heart Association has led an effort by being one entity that has brought together all the different efforts in the country into a vision and leadership. And the results have been, in the last 20 years, deaths by heart disease have dropped by 30% in the last 20 years. In cancer, the American Cancer Society has done the same thing. They've brought together a lot of individual ideas happening and initiatives happening in different states, in different smaller entities. In the last 20 years, deaths related to cancer have dropped 20%. 30% down in heart, 20% down in cancer. Likewise, as I mentioned in my remarks, there is no such entity for drug and alcohol addiction. The results in the last 10 years, down 30, down 20, the deaths related to drug poisoning have doubled in the last 10 years with no such entity. So I guess I would finish my remarks, which I started earlier, with hope. with a new national organization that doesn't exist for drug and alcohol addiction. The results have been pretty phenomenal with heart and cancer. And we can take these ideas and we can put them into action in a national entity which has the power to leverage policymakers and people around this country to get the same results that have been achieved in cancer and heart. And that's our vision, and that's our pledge to the Clinton Health Matters Initiative.
Thank you, Gary. We now have a few minutes left. We can take questions from the audience.
Hi, my name is Rudy Gutierrez, and when we speak about mental health, one of the components I don't really hear about or see a lot is the youth who are mentally, physically challenged, that are born with a condition that they have no control of. I helped kickstart a Little League program out in Coachella, and the Challenger Division is something Little League established back in 1989. And just to go through that program in the last 3 years is huge. Because we tend to, I don't know where we would classify it as far as mentally, physically challenged youth and young adults. But we're missing that component here in the Coachella Valley. There's a few organizations here that help out with youth and young adults who are mentally, physically challenged. But it's a trickle effect. The family members that are affected by it, the residents involved in the communities. What would be, I guess, your guys' thought on health matters for youth and young adults who are physically, mentally challenged, that it's not a drug addiction or an alcohol, something that they put in their body, they're born with it. How do we engage those folks and encourage them to be healthy members of society and not just push them in a place where they don't have a voice? And our issue out here in the Coachella Valley is there's no space for a lot of the youth to go to who are mentally or physically challenged. And so I would encourage anyone here that has an idea or thought of how we can engage the Coachella Valley, not just residents of Coachella or residents of Cathedral City or Palm Springs, but make it a Coachella Valley effort. Thank you.
Would like to address that. Carolyn?
One of the things we have at St. Chris is a special needs clinic, and that special needs clinic addresses just what you mentioned. Not all the children have a mental health issue, but they all have at least physical health issues. And so we have that clinic partnered closely with our developmental pediatricians and with what we're doing with our Center for the Urban Child. If we can get some of the lower level behavioral health issues out of the psychiatrist's office, then the psychiatrist can be freed up a little bit more to care for the kids who do have the complex medical conditions who are more difficult. And I think a medical home is really something good for that, and it's something that we're developing, and I'd be happy to talk to you about that if that would be helpful.
Over here.
Thank you. Gary, I'm so grateful that you challenged us last year to talk more openly and comprehensively about mental health. One thing I kept thinking about while each of you were talking is another conversation that clearly is long overdue in our country, and one that we have just started to have around bullying. And bullying often seems to fall on both sides of the mental health equation, in that bulliers and those bullied often struggle with depression, anxiety, have been clinically diagnosed with mental health challenges. So I just would be grateful to hear whomever would want to comment on how you think your work, either Mr. Schwartzberg in the school district or Carolyn at St. Chris's, or anyone who's working on addiction, how you think about your work helping to ameliorate the real challenge of bullying that seems to be so pervasive these days in our schools, in online chat rooms, and across the country. Thank you.
Again, back to where we started talking before, what we're seeing is that the first step is, I don't want to say confrontation, but talking. Because in the program that we're working at in this school, which is right near your folks' house, actually. We're listening to these kids actually come out and say what's on their mind, and it's helping some of the problems. The kids are coming out and actually talking about what's bothering them about the other people, and the dialogue being built is attacking the issue of bullying, because as you said, the bullies themselves generally have something going on themselves, and this is their outlet. And if we can do a good job of cutting their legs out from under them by letting them just speak openly, and let the other kids are speaking to them saying it's not all right. And again, I hate to minimize things and make it that simple, but it's as simple as letting the kids openly talk and hit these issues. And we're seeing in various places, and the folks at University of Michigan are seeing the same things, that open dialogue is working. Because in the past, a lot of times it was the kid being bullied that was told, oh, just stay home, don't do anything. Now it's a very open dialogue, and that's attacking a lot of the issues and helping them.
And I know one of the things, we haven't focused on this too much at St. Chris, but when I was in Texas prior to moving to Philadelphia, our local school district was very involved with Rachel's Challenge, which is something that Rachel Scott's parents created, and she was one of the students killed in Columbine. And it was all about cutting out bullying. They would form organizations within the schools where it was their job to befriend everybody, and it was their job to have random acts of kindness. And they created this chain of caring and wrote down all the events that they did in the schools in that district that were caring for others. And it was amazing how many times the chain wrapped the football field, and they had this amazing ceremony that really just engaged the community and engaged the kids. So there are things out there. I think that's something that is really a partnership with the schools as well as with the pediatrician's office and the communities.
There's a wave of change happening in schools right now as people are starting to figure out that school climate is really the most important thing that you can do to first of all impose discipline on the school, but also to provide incentives against bullying. And there's a wonderful program out there that started in Chicago that actually President Obama was a big proponent of in the Senate called PBIS, which is all about framing schools instead of around just punishing bad behavior, incentivizing good behavior, positive behavioral incentives and supports. We've invested a lot of time and money in that in Connecticut, and we've seen it pay dividends in terms of referrals into the school discipline process, but also it's paid off dividends in terms of the number of incidences of bullying. We actually have a very strong bullying law in Connecticut whereby we force schools to report incidents of bullying so we can track who's doing well and who's not doing well, and repeat the pedagogies of those schools that have reduced their incidents. PBIS is one of the success stories that has reduced bullying, and we're actually pushing some legislation in Washington to try to provide some money to bring it out to states that haven't seen it yet.
It's very hard to find money for prevention, and that's, I mean, prevention, when I think about what happened in Connecticut, that's one of the things I focus on is you know, do we as a society, can we decide we're going to pay for this, whether it's private dollars, public dollars. I was telling a couple of members of the panel that we have a unique children's program at the Betty Ford Center for children from 7 to 12 that live every day of their life with addiction because of their parents or, you know, step-parents. But it's very hard to find programs like that because nobody's willing to pay for them. And how do we change that commitment of our society?
If I could jump in on that, what we saw with the program that we started at this high school was when we came in to speak to the school about what they're doing for depression, anxiety, teen suicide, they had no program. And their answer was, we have nothing in our budget. And our answer to that was, well, we'll pay for it and we'll bring the resources in. And the educators told us it was the first time in 35 years that they had a private member of the community come in and say they'll do that. So it comes back to being a good member of the community, and it's not necessarily just writing a check, but spending time putting your resources in. But it's shocking when you look at the cost that it has to our economy of mental health. When I said before, $50 billion just from absenteeism. it's not that hard to put these programs together, and the economics are very simple. It doesn't make sense as to why we can't.
Just do something simple like holistic budgeting. The costs of not investing in your mental health system don't take 10 years to pop up somewhere else on your budget. They actually show up on your budget in that 12-month period of time. In the last 2 years, we have closed 4,000 psychiatric inpatient beds in this country. During that same time, prisons have seen a 25% increase in the number of prisoners with serious mental illness, right? That is, and we all know that a prison bed is going to cost you $30,000 and the inpatient psychiatric bed is going to cost you much less. And so if you just did a different way of budgeting, you'd find those dollars that you're not putting into prevention, you're not putting into mental health, somewhere else in your system, whether it's in a homeless shelter or in a prison, in real time, not 5-10 years down the line.
Hi, I'm Mark Casson. Two-fold question. Except for Gary, I didn't hear what specifically is being done to try and demystify mental illness in terms of giving it a face so it's seen as a disease like another disease. And who are you reaching out to, if anyone, and what else do you need? I mean, you have members of the media here, you have members of the entertainment industry to help you put a face to it, to speak to the people at large without fear.
Sure. The answer is your question is what's being done and what can be done, if I can put it in two parts. Okay, so 3 parts. What's being done, what can be done, and how can people help? Fair? So what's being done is very little, is the answer. As I said, you have American Cancer, you have American Heart, you have American Lung, you have Autism Speaks, which does a wonderful job. It's only 7 years old. There is no American Addiction and Mental Health Society. It doesn't exist. So, first question number 1, what's being done? Very little. Half the Americans in the United States, just read a Gallup poll that was done last year, half the Americans in the United States don't believe drug addiction is a disease. It is scientifically proven that I mean, the reality is about 80% of kids in high school try drugs or alcohol. Those aren't all bad kids, 80% of kids. They're all our kids. But 1 in 12 become addicted, 1 in 12. And half of those who become addicted because it's genetic, and the other half become addicted for certain risk factors. Probably 50 points is genetic, 30 points is other risk factors, and there's 20 points, it's pot luck. So the reality is in answer to your question, very little is being done. What can be done is we need a national entity to represent these diseases and raise the dollars that are raised by those entities. For example, American Cancer raises $950 million a year. Most of it is raised by millions of people putting in $20 or $30 each. American Heart raises about $600 million a year. Again, about 85% of it is people putting in $20, $30, $40 each. But the beauty of it is not only are they putting in $20 or $30 or $40 each, but by contributing that, they're becoming members, they're becoming activists, they're writing letters to their congressmen, they're getting laws changed. So I'm kind of leading to the third question of what needs to be done and how can everybody help. The first thing you can do, again, in my opinion, is go to brianswish.org and sign up with your name and your email address, and then we will keep you informed as we move forward. What I see our entity doing, which I think is the answer and the solution, is taking all these wonderful ideas that we've heard up here today and finding out which ones have evidence behind them working and which ones can be brought to scale across this country. If there's something done in New York City and we can show evidence that it's working, Why are we doing it just in New York City? Why can't we replicate it and do it across the country? If there's something being done in Philadelphia, if it's working, we should find a way to bring it to scale and bring it across this country. And the same thing with Harris is doing. In one school, we should test it. We should randomly control it versus another school with similar characteristics, see if it's working. And if it's working, we should take it across the country. That's what's done with American Cancer and American Heart. American Cancer spends $125 million a year in research. American Heart spends $95 million in research. For this field, privately, we're talking less than a couple $1 million of research per year. 125 million, 95 million, less than a couple million. So that's what needs to be done, in my opinion. And I think this, I'm not saying it's easy, but it's doable. It's been proven by American Cancer. It's been proven by American Heart. It's been proven by Mothers and Drunk Driving. It's been proven by Autism Speaks. It can be done. There's no question it can be done. I'm not saying it's going to be easy. Please go to brianswish.org and give us your email address. We'll give you updates. And I want to work together with this team up here, which have all brilliant ideas, and find out how do we take these ideas and bring them together and scale them across the country. To me, that's the answer.
Thank you, Gary. And we've run out of time. I want to thank all the members of the panel. And, oh, please. Oh, Dr. Satcher, yes.
And certainly don't want to take anything away from American Cancer and American Heart. A lot of things have happened in the last 60 to 70 years when it comes to heart disease and cancer in terms of governmental commitment to research. But also I just want to mention the National Association for Mental Illness, a group that's really been working hard. But I think you're right in that they have not gotten the kind of support that American Cancer and American Heart. I think we should rally around organizations like the National Association for Mental Illness. These are primarily families that have had experience like you've had, and they've tried to come together. But the lobby has not been nearly as powerful as cancer, and I think that's partly because of the stigma that we've been discussing. So I think this has been a great panel, and I think we have an opportunity to move beyond that.
Thank you.
Thank you, everybody on the panel, for being here.